Hi, I'm Melissa Washington, and I am here to tell you about immunity and vaccinations. There are two types of immunity, active and passive. Active immunity is the adaptive process that allows the body to make antibodies in response to the entry of antigens into the body. It develops over several weeks to months and is long lasting. Passive immunity develops when antibodies that are created by another human or animal are transferred to the client. Because the client does not independently develop antibodies, passive immunity is temporary. In active immunity, there is active natural, which develops when the body produces antibodies in response to exposure to a live pathogen that enters the body naturally. There is also active artificial, which develops when a vaccine is given and the body produces antibodies in response to exposure to a killed or attenuated virus. In passive immunity, there is also passive natural, which occurs when the antibodies are passed from the mother to the fetus or newborn through the placenta and breast milk. There is also passive artificial, which occurs after antibodies in the form of immune globulins are administered to an individual who requires immediate protection against a disease where exposure has already occurred, such as following a bite from a poisonous snake or an animal who has rabies. After several weeks or months, the individual is no longer protected. The Tdap and Td vaccines are for whooping cough, tetanus, and diphtheria. You should get one every 10 years for adults 19 and older, and pregnant women should receive the vaccination between 27 and 36 weeks gestation to protect from pertussis. Recommendations for the MMR vaccine are 1 to 2 doses for clients between the ages of 19 and 49 that lack documentation of immunization or prior infection, or have laboratory proof of immunity. People born before 1957 are considered immune to measles and mumps. Pregnant women should not receive this vaccination. Allergies to gelatin or neomycin is also a contradiction with this vaccination. Use caution when administering to a client who has thrombocytopenia or thrombocytopenic purpura. The varicella vaccination is 2 doses to adults who do not have evidence of a previous infection. Give a second dose to adults who have only had 1 dose, depending on the zoster vaccination. It is contradicted for pregnant women, clients who have some cancers, or hypersensitivity to neomycin or gelatin. It is not recommended for clients who have HIV, congenital immune deficiencies, or those taking immunosuppressive medications. There are 2 monococcal vaccination types. The PCV13 can be given as young as 2 years old with a medical condition like asthma, COPD, cancer, and 19 years old and older. For those who smoke, it is recommended. The PPSV23 is a second vaccination 1 year after the PCV13 for 65-year-olds. The hepatitis vaccinations available are hepatitis A, which is oral fecal route, and food prep. It is recommended 2 doses for high risk of individuals 6 months apart, 1 month after the first dose. 94% to 100% of adults and children develop a protective level of antibodies. Adults who receive the second dose have 100% protective levels after 1 month. Hepatitis B is transmitted through blood and sexual fluids. It is recommended for 3 doses. There must be at least 1 month between the first and second dose, and at least 2 months between the second and third doses. A minimum of 4 months are required between doses 1 and 3. Clients have a greater than 85% protection after the second dose and more than 90% after the third dose. The antibody duration is 5 to 7 years. The influenza vaccination is recommended for all adults annually. Inactivated influenza vaccinations are approved for clients who are pregnant. Recombinant influenza vaccinations are approved for adults 18 years and older. The live attenuated vaccination, given as a nasal spray, is indicated for only adults under the age of 50 who are not pregnant or immunocompromised. Clients who have an allergy to chicken eggs, previous severe reaction to the influenza vaccination, or previous Guillain-Barré syndrome should not receive this influenza vaccination. Administration recommendations can change yearly because the vaccination is created with different influenza strains each year. The vaccine is typically available beginning in early fall. The HPV vaccination has 3 types of vaccines, but only the 9-valent vaccination is available for use in the United States. It is administered to adolescents as young as 9 years old, but usually by the ages 11 to 12. If the initial dose is administered before the age of 15, only 2 doses are required, and the second dose should be given 6 to 12 months after the first dose. If the initial dose is administered after the 15th birthday, 3 doses are required. The second dose is recommended 1 to 2 months after the first, and the third dose 6 months from the first dose. The zoster vaccination is recommended as 2 doses of recombinant vaccinations to all adults aged 50 years and older. Shingrix works to boost your body's protection against shingles. Your immune system declines as you age, and that puts you at an increased risk for shingles. For those who are 50 years and older, Shingrix helps your immune system defend against shingles regardless of age. Shingrix is given as a 2-dose series, with the second shot administered 2 to 6 months after the first shot. To get protection against shingles offered by Shingrix, it's important to get both shots. The main difference is that Shingrix is more effective at preventing shingles than Zostavax. Shingrix is an FDA-approved vaccination to help prevent the occurrence of herpes zosters and shingles.